Welcome back to another episode of Minutes with Margaret. I am Dr. Margaret Coates, Superintendent of Owasso Public Schools, and I'm joined here today by Miss Kellie Aylor. She is our lead nurse for the district, and she serves Stone Canyon and Mills Elementary. And so today we're going to talk about health services. So Miss Aylor, can you talk to us about the structure of our health services department? For example, how many RNs do we have and health aides and the services we provide to the district?
So we have 9 RNs that service our district with 6 health aides. And our health aides are paired with our RNs, and we cover 15 different sites for our Owasso Public Schools.
15 sites,
15
that's a lot.
sites.
Yeah.
So we have a health service team of 15 of us that cover. Our elementary nurses cover 2 sites with the assistance of our health aides. Our secondary sites are set up with having an RN at the East Campus and our West Campus, which is a huge help, and then the assistance of a health aide to travel where needed, depending on the needs of that day. So we are fortunate to be able to cover all of our sites with a health professional, which is wonderful. We also get to house, we have 3 sites that house our SPED program with our more severe complex issues, and we have an RN full-time at those sites to be able to care for those needs and treatments during the day that we service.
Okay, so Ms. Aylor, can you tell us what the primary role of having health services personnel in our schools? Why do we have health services? Why is there a need for that?
So our health service team, our primary goal is to support the educational process for our teachers. And by doing that for our students, we get to improve their health. And because we know that healthy children learn better. And so we want healthy children in our classrooms so they're there for more classroom time. We get to support and implement health plans and health care plans for our kids with more complex needs, those types of treatments for those that maybe it does impact their learning, but we can help them succeed in the classroom by partnering with the teachers and the parents when we come alongside with health needs.
We are in the middle of cold and flu season right now, so are there any specific tips or helpful advice that you can provide for our families during this time?
Yes. So at the beginning of the season, we try and get information out to our teachers that share with our students, just starting with basic simple techniques of hand washing, proper technique, when to wash our hands, some of those things that we can do on a day in and day out basis, not sharing our food and our drinks with our friends, washing our hands as we talked about, covering our coughs and sneezes, those things that we can do in the classroom setting to keep each other safe. But we know we're gonna get sick. It's gonna happen, and that's where we partner with our parents in keeping our students home when they should not be at school due to certain illnesses. The coughs and colds and stuff that come along without the virus or without a fever, those students can be at school, but that's when it kind of becomes a judgment kind of call for a parent. If the student's not well and don't feel well, they're probably not going to learn well that day. So that kind of becomes a judgment call for the parents to work with us if the student to be in school. But there are some definite indicators on symptoms when a student should not be at school, and those are our fever greater than 100 degrees for more than 24 hours. And then vomiting, diarrhea, also during 24 hours. And then our, obviously now our communicable diseases. We have flu, strep throat, and then our COVID.
Yes.
So those are some reasons that our students should definitely stay home during that time frame. And all of our guidelines through the district and policies that we follow the Oklahoma State Health Department, backed by our Oklahoma State Department of Education, which all fall in line with our Oklahoma Board of Nursing. So those guidelines that we do put out to parents to follow when our children and our students are sick come from and help us guide our students to keep us all healthy and safe.
Thank you, Nurse Aylor, for your time today. We really appreciate the information and all that you do and all that the nurses do and our health aides do to serve our students and families on a daily basis. We could not have the healthy and safe environment that we have in our schools without you, so really appreciate you very much. So this concludes our episode with Minutes with Margaret. We look forward to seeing you next time.